Right now. So this week, we got some pretty big news from Pfizer. The company announced its COVID vaccine is effective for kids 5 through 11, but they still have to go through steps before kids can officially start getting vaccinated. We're joined by Dr. Janis Orlowski, the Chief Healthcare Officer of the Association of American Medical Colleges. Doctor, thank you for being with us here this morning. Good morning.
Good morning.
All right, so talk a little bit about what still needs to happen before kids can start getting these shots. This doesn't sound like a done deal just yet.
It's not a done deal yet, but I have to say it's very good news. Pfizer will have to provide information to the FDA about the efficacy, does the shot work, and the safety. And they've been doing that all along, and they've been talking with the FDA, but this will be a final review. And so the FDA's panel will have to take a look at that data and approve it. Then it'll go to the CDC, and the CDC's Advisory Committee on Immunization will also look at the data. And so the FDA is looking at it sort of a safety issue, and the CDC is saying, is this the right thing to do for kids? And so they have slightly different questions, but in all, then they'll make a recommendation. It's thought that this is going to move forward, and possibly by the end of October, beginning of November, if everything is safe and if the data is what we believe it is, that it will be available for our children. And that would be terrific news during this pandemic.
It's so interesting because the way I've looked at this during the pandemic is we've really sort of had a front row seat to real-time data in the middle of a virus outbreak or a pandemic, where we're looking at drug trials and we're seeing approvals from the FDA, all things that we really weren't paying a lot of attention to before all of this. For people who are thinking, oh man, all of this has been so rushed. I mean, what can you say to people? Because it does seem like we are watching this play out in real time right now.
Well, we're watching it play out, and some people are saying, oh my gosh, it's so messy. But you know what? You've got a front row seat. It is messy. And people argue, and people, you bring people who are absolute experts on one part of the vaccine and the other, and they argue about whether this is the right thing. So this is how science works. And, this is why we have peer-reviewed journals, so we can publish results and other people can look at them and argue and whatnot. So it's a front row seat. What I would say also about this being rushed, the underlying technology for this vaccine has been studied for more than 2 decades, more than it's around 3 decades old. And this is why we as Americans support the NIH, and the NIH gives grants. And so the underlying basic science research we've been working on for decades and decades. We've been able to pluck it out and use it during this vaccine. The other thing that I would say is that if you take a look at how many shots have been given, there are more than 200 million shots have been given, and we really have a good idea of the safety profile. So this is front row science, and as a science nerd, I find this very exciting. And what I want to convey to the public is an understanding of what I would say sort of the multiple steps that we go through before we make a recommendation to the public.
I love how you said that, front row science, and we are witnesses to that, and also history as well. I want to ask you really quick, what's the latest guidance for getting boosters right now when it comes to that Pfizer vaccine?
So the CDC panel will meet today regarding that. The FDA approved it for people older than 65, people who are immunocompromised, and healthcare workers, or people who are at high risk. So that's the FDA recommendation going to the CDC today.
Doctor, appreciate this information. Thank you so much for joining us here.
My pleasure. Have a wonderful day.
Thank you. All right, 7:19 right now. Let's track our forecast this morning from one science to another science, MJ. Hi.
That's right, from the biological sciences to the atmospheric sciences. And you can see fog at the Narrows Bridge, the top of the bridge. Invisible right now. The roads look fine, though. Snohomish County, we had fog in Everett earlier. It's going away, just cloudy right now. And we're already seeing the clearing from the north here through the Strait of Juan de Fuca. There's the blue sky looking out over the strait, where it's felt fully 49 in Port Angeles. You can tell where we had the clear skies overnight. 54 Bremerton and Shelton, 53 in Tacoma with that fog, and 54 in Everett. Seattle's at 56. It's going to be a very nice day with afternoon clearing and highs in the upper 60s to around 70, which is spot on for north.